Well, hello, good afternoon or morning, depending on where you are, and welcome to the CMS Quarterly Town Hall meeting. My name is Laura Mankin, and I'll be moderating today's session. I serve as a Learning and Diffusion team member for the Kidney Healthcare and National Analytics Contract, or the KHARES team. Today, we're going to discuss CMS's broader vision for kidney care quality and transformation, as well as the roles for CARES, the ESRD networks, and patients in helping the ESRD community work together to bring that vision to life. Joining me for today's discussion are a few of our leaders from CMS's Eye Quality Improvement and Innovation Group, the Division of Kidney Health, the National CARES Program, the ESRD networks, and a patient representative. I wanted to start by mentioning our CARES Contract Officer Representative, Sherry Morgan Johnson, who's here with us today and a great leader on our team. We also have Jim Todd and Kim Jones joining us from CMS as our subject matter experts. I'd like to now invite each of our panelists for today to briefly introduce themselves. I'll start with Tracy Archibald.
Hi, good afternoon. My name is Tracy Archibald. I am the Acting Director of the Quality Improvement and Innovation Group within the Center for Clinical Standards and Quality. And my background is as an occupational therapist.
Thank you so much, Tracy. We'll now go to Ann Turner with CMS.
Good afternoon, everyone. I am the Deputy Division Director representing the program on behalf of Melissa Dorsey, who is the director who would have loved to be here, but she is out this week.
Thank you so much, Ann. I'll turn now to Vicki Cash. Vicki, I think you're on mute. All right, we'll come back to Vicki. Mary Albin.
Good afternoon, everyone. Mary Albin. I'm the Executive Director for the ESRD Networks 8, 7, 8, 13, and 14. That's a mouthful, but thank you all for being here today.
Thank you, Mary. And Dawn Edwards.
Good afternoon, everyone. I'm Dawn Edwards. I'm a 35-year kidney patient from Jamaica, New York, as well as a patient advocate. Thank you for inviting me to join today.
Thanks for being here, Dawn. Stephanie Hull.
Hey, good afternoon, everybody. This is Stephanie Hull. I am the Community Engagement and Partnership Specialist with the CARES team.
Thank you, Stephanie.
I'm back, Laura.
Great. Thanks. Glad you're back, Vicki. Go ahead.
Yeah, I'm the Director of Community Engagement and Program Management with CARES and a nephrology nurse for 42 years, working in the network program for the last 13. So very happy to be here.
Great. Thank you so much. Thanks to all of our panelists for being here. So I'd like to begin by learning more from Tracy about CMS's kidney care leadership. Tracy, could you please provide the audience with a brief overview of CMS's organizational structure and the resources supporting kidney care quality and transformation?
Thank you, Laura. CMS's work in kidney care quality and transformation is supported through the Centers for Clinical Standards and Quality, which is directed by Dr. Dora Hughes, who's the CMS Chief Medical Officer and Director of CCSQ. Within CCSQ, I work as the Acting Director of the Eye Quality Improvement and Innovation Group, or IQIG, and we focus on improving lives, health outcomes, and the experience of care for people that CMS serves. The vision is to improve care through innovative, data-driven, and evidence-based quality improvement methods that produce demonstrable results. IQIG supports quality improvement through several key programs and resources, including beneficiary and family-centered care QIO work, the Quinn QIO program, which is working towards targeting improvements in health outcomes for working with providers and beneficiaries across the country, support for the American Indian and Alaska Native settings, and providers, as well as opioid prescribing support, and then the ESRD networks that we are here today with. The 18 ESRD networks play a critical role by providing quality improvement assistance to dialysis facilities and supporting transplant providers who care for people with kidney failure.
Thanks, Tracy. It's really encouraging to see the level of expertise and the resources that have been dedicated to kidney care. So during the first 6 months of the year, there's been a major focus on launching the ESRD networks and the CARES contract. CMS also took an important step by creating a communications toolkit to help the ESRD networks align their messaging and share this work with the broader community. Could you provide an overview of the larger CMS vision reflected in that toolkit and some of the key themes that support it?
Yes, thanks. CMS's vision for kidney care quality and transformation is to move the care for beneficiaries who are receiving dialysis to a more patient-centered, coordinated, accountable, and data-driven system that improves outcomes and quality of life for people with kidney failure. In other words, that means transforming kidney care from a fragmented, facility-centered system into a coordinated, patient-centered model. This model expands patient choice, improves outcomes, strengthens emergency readiness, and advances equitable access to high-quality care. Key themes reflected in the toolkit, the communication toolkit, include being transparent and accountable, making sure patient voices are heard, including the 4 pillars of transformation, data-driven excellence, emergency preparedness, and outcomes. Later, you will hear from Ann Turner, who's our Deputy Director of the Division of Kidney Health, and she will outline the 4 pillars of transformation and describe how the networks are translating that vision into practical action.
Thanks so much, Tracy. Understanding that CMS leadership and that broader vision really helps to align all of the work. So as Tracy mentioned, next we'll move to Ann from CMS. And we'd love for you to please describe those 4 pillars of transformation that CMS has identified for kidney care.
Absolutely. Let me walk through what we're all about. CMS has identified 4 priorities that serve as a foundation for a stronger, more connected, and more patient-centered ESRD network program. First, empowering patient and family choice. Choice matters. So this effort is being led by Sherry Morgan Johnson, and every patient deserves a seat at the table and a real voice in their own words, in their own care. So this means making sure that patients and family understand the full range of treatment options, including in-center dialysis, home dialysis, self-care, and transplantation. We are championing shared decision-making so patients, families, and care teams can make choices that fit a person's life, not just their diagnosis. Second, improving care coordination. No one should fall through the cracks, and Chris Cote, as mentioned, will be leading this key priority. Great kidney care does not happen in a silo. It takes dialysis facilities, hospitals, nephrologists, transplant centers, and other partners working together across the care continuum. Our goal is smooth, connected, and coordinated handoffs. Whether a patient is transitioning from a hospital stay back to dialysis or being evaluated for transplant. Third, promoting whole health. We are focused on the whole patient, not just the kidneys. ESRD affects every part of a person's life, and care should reflect that. This includes preventative health, behavioral health, vaccination, nutrition, and the broader needs of people living with ESRD. Whole person care is just not a buzzword. It's a commitment, and the one that Kimberly Jones has accepted to move this work forward. Fourth, enhancing data interoperability. We can work smarter, not harder. Good intentions are important, but good data makes the difference. CMS is moving away from isolated after-the-fact reporting and towards timely, actionable information that drives improvement. James Todd will be leading, and because we know when network facilities and partners and share and use data effectively, we can spot trends, close gaps, making meaningful changes faster. Together, these 4 priorities represent our commitment to listening to patients, families, connecting the care team, seeing the whole person, and acting on the best available information.
Thanks so much, Ann. I love what you said about choice and shared decision-making and how data really can make a huge difference. So CMS has identified these pillars as central to advancing kidney care transformation, but I know they also rely on several core competencies. Could you discuss some of the competencies that CMS has identified as essential to supporting the work?
Great question. The pillars don't stand alone. They're powered by core competencies that make this work possible. transparency is not just a nice to have. It's the backbone of everything we do. CMS has built a robust framework around performance measurement and public reporting that keeps us all honest and focused on what matters most. Through collaboration with other CMS programs like the ESRD Quality Incentive Program, also known as QUIP, is a prime example. It uses clearly defined quality measures that span across clinical care. Are our patients getting the right care? Care coordination. Are the right people talking to each other? Safety. Are we protecting patients from harm? Patient and family engagement. Are patients truly part of the conversation? And reporting domains. Are we capturing and sharing the right information? Transparency and accountability connect directly to each of the 4 pillars. When we measure performance, report it, and take ownership of it, we create the conditions for improvement. The second competency is building resilience and emergency readiness, because dialysis, it doesn't take a day off. I'll break down the alignment to our empowered patient improving care coordination. And here's something that doesn't always get the spotlight it deserves, but it absolutely should. For patients who rely on life-sustaining dialysis and disaster disruption or public health emergencies isn't just an inconvenience, it can be life-threatening. That's why CMS has invested in building what we call an unbreakable safety net, a toolkit, a framework designed to make sure patients maintain access to care no matter what. And through the ESRD CARES emergency response, coordination, and network partnerships, we can create a unified emergency response infrastructure that connects networks, facilities, and partners when it most matters. This competency directly supports Sherry's pillar, because patients can only make empowered choices if they have uninterrupted access to care. And Christina's pillar, because emergency response is ultimate test of whether your care coordination is truly working. So the message is clear. We plan for the worst so the patients can count on the best. These 2 competencies help ensure that our work is measurable, meaningful, and that patients are protected even in crisis, and the networks are connected, coordinated, and ready.
Thanks so much, Anne. The 4 pillars and the supporting competencies really give us a clear picture of that direction. Could you also please share how you see the ESRD networks taking that national vision and translating it into practical action across the community?
The pillars tell you where we're going, and the competencies make sure we're actually getting there. That's really where the rubber meets the road. And honestly, this is where the networks shine. The ESRD networks and the CARES are critical links between CMS national vision and what actually happens on the ground in communities across the country. Think of networks as translators, the connectors, and the doers, turning big picture priorities into real measurable action for patients and the providers every single day. So let me try to translate our ESRD priorities into local action. Networks don't just pass along CMS guidance. They make it real and relevant for dialysis facilities, transplant centers, patients, partners at the regional level. They help every stakeholder understand not just what CMS is trying to achieve, but why it matters and how their work fits into the larger transformational agenda. Whether it's Sherry's patient and power work, Christina's care coordination, or Kimberly's whole person care focus, or Jim's data priorities, networks are the bridge that connects the national intent to local impact. Along with CARES, we can use the data to identify needs and drive improvement, aligning to Jim's enhancing data interoperability. Networks don't just connect data, they put it to work. By analyzing performance trends and identifying barriers, networks can target technical assistance exactly where it's needed most. The results? Facilities aren't guessing about where to improve. They have clear, actionable insight and drive measurable results. This is Jim's pillar in action at the regional level. Real data, real time, real improvement. We are advancing patient-centered care, and you will see Sherry's work in empower patient choice. Networks make sure that improvement work isn't just driving the clinical or the operational metrics, it's reflecting lived experience of patients and caregivers. Across all 4 pillars, networks help facilities test interventions, spread promising practices, address gaps, sustain improvement over time. They also reinforce transparency and accountability by helping stakeholders understand performance outcomes, reporting, progress, and challenges. Emergency preparedness and response are also critical. Networks maintain situational awareness and support communication during disasters and disruption. For dialysis patients, a gap in care is not simply an inconvenience, it is a crisis. Finally, networks align messaging across the ESRD community. Using these tools such as the Community Communications Toolkit, as Tracy mentioned, they help ensure broader community hears consistent CMS-aligned messages across kidney care transformation. One vision, one voice, one direction builds trust and engagement. So the bottom line is the 4 pillars tell us where we're going, and the companies give us the tools to get there. The ESRD networks, supported by the CARES national infrastructure, help make the journey happen. One region, one facility, and one patient at a time, Laura.
Thanks so much, Anne. You really helped to frame up that vision and transformation very well. We appreciate it. So you just mentioned kind of that national infrastructure. So we'll now turn it over to Vicki from the CARES team to talk about how the CARES team supports that work. Vicki, from the national contractor perspective, how do you see your role in helping CMS advance the larger vision for a more patient-centered, coordinated, data-driven, and resilient kidney care system?
Thank you, Laura. CARES is here as a national support infrastructure that helps connect CMS's vision to the action across all the 18 networks. Our role is to help them make the systems more consistent, coordinated, and data-informed, while supporting local implementation by the networks. CARES brings together 3 major functions: national emergency preparedness and response, data analytics and performance insight, patient and family and community engagement. Through these functions, we support CMS by helping identify national trends, emerging risks, promising practices, and opportunities for improvement. We also help communicate CMS's vision through monthly community of practice calls, town halls such as this, and the annual quality conference and expanded social media reach. Ultimately, CARES helps create a strong national kidney care system that is better equipped to support patient choice, whole person care, access to care, and dialysis continuity.
Thanks, Vicki. So CARES is designed to support all 18 of the ESRD networks nationally, but we also know how important that local context can be. How will CARES help the networks work more consistently and efficiently, but still allow them to respond to the unique needs of the local communities?
Great question. CARES will provide standardized tools, dashboards, templates, change packages, training, and technical assistance, so networks don't have to build everything independently. This reduces duplication and allows networks to spend more time working directly with facilities, patients, families, and partners in their regions. At the same time, we recognize that each network serves different communities with different needs, barriers, and resources. Our approach is to provide a national framework with local flexibility. We support cross-network learning, so successful strategies in one region can be adapted and spread nationally. CARES will also help CMS and networks see where challenges are shared nationally and where targeted regional support may be needed. That balance between consistency and flexibility is essential to make the national vision practical and meaningful at the local level.
So that's helpful. And if you could leave the ESRD community with one message about how CARES will bring that vision to life, what would that be?
Yeah, so CARES is here to strengthen the national foundation that supports ESRD networks, providers, patients, families, and partners. Our focus is on making the system more connected, prepared, data-informed, patient-centered, and responsive. We will listen to patient and families, support networks, coordinate during emergencies, use data to guide action, and help spread what works. CMS's vision is ambitious, but it's achievable when the ESRD community works together. CARES will help connect national strategy with practical action so that kidney care transformation is not just a concept, but something that patients and families can experience in their daily lives.
Thanks, Vicki. It's really helpful to hear how CARES can support that national vision. And then now we'd like to turn it over to our ESRD network representative, Mary Albin, because the networks where much of this national vision really becomes visible in the communities, facilities, and patient care. So Mary, we'll bring you in. And from that network perspective, how do the ESRD networks translate CMS's national vision into practical action across dialysis facilities, transplant centers, patients' families, and community partners?
Thanks, Laura. And as Ann was sharing earlier, I was listening to her and I thought she covered a lot of my points, but the network really does serve as the bridge between CMS priorities and what happens down at the local level. And our job is to translate CMS goals into practical steps that facilities and providers can implement to improve care for patients. Our goal is really to help turn CMS priorities into I can't say that word, tangible results. We work closely with the dialysis facilities, transplant centers, patients, families, and community partners to make sure that those goals are translated into meaningful improvements in care. And a big part of our role is helping providers understand what CMS is trying to achieve and giving them practical tools to support and make those changes happen. Through the use of data, as Ann was sharing, through a data interoperability and the systems that we use, we're able to provide education and quality improvement strategies that work to help facilities improve outcomes. Along with that, we also do recognize that every community is different. So there's no one size fits all for any of our approaches that we take with our providers. And we tailor that support based on the needs of the facilities individually. At the end of the day, our focus is on helping patients have better access to care, more treatment choices, stronger care coordination, and a better quality of life. And what really keeps me motivated is remembering that behind every data point is a person.
Thanks, Mary. That's really important. So the network statement of work describes networks as conveners, organizers, motivators, and change agents. What does that look like in practice when you're working with the facilities, providers, patients, and stakeholders?
The way I see it, being a convener means bringing the right people to the table. We're able to connect dialysis providers, transplant centers, physicians, hospitals, patient advocates, and community organizations so they can work together on a common challenge. This creates opportunities for people to learn from each other, share what's working, and solve problems together. As organizers, we help keep improvement efforts focused on connecting partners with resources and support. A good example of this is we've all seen it firsthand, and even more recently, the critical importance of emergency preparedness, as Ann was talking about, and what the CARES helps drive as well. The networks play a vital role in bringing the facilities and emergency management partners together before a crisis occurs to help ensure that patients continue to receive care that they need when it matters the most. As Ann was sharing, one missed treatment could be detrimental to our patients. As motivators, we encourage process improvement and celebrate successes. That's really important. That goes a long way with our providers, that we celebrate with them when they have a success. And as change agents, we help improve ideas into action. And whether that's testing a new approach or tracking results or helping facilities sustain improvements over time, our main goal is to always support better outcomes for our patients in our work.
Thanks so much, Mary. That's really helpful. And we heard from Ann earlier about the 4 CMS pillars of transformation. So empowering patient and family choice, improving care coordination, promoting whole health, and enhancing data interoperability. So Mary, can you help to share how networks are supporting those priorities in the day-to-day?
Absolutely. They really are reflected in our work that we do every day at the network. As we support our patient and family in choice to help patients learn more about their treatment options, including home dialysis, transplantation, so they can make an informed choice. That's a priority, what works best for them. and what they get to choose. And through our technical assistance, we support care coordination by working with facilities to identify and reduce barriers, improve transitions between care settings, and address issues that can lead to hospitalizations for patients. And through the promotion of whole health, which is really new to us in this work, we're encouraging our providers to focus more than just on dialysis treatment itself. They need to focus on the mental health, nutrition, vaccinations, opportunities for employment, and overall better quality of life for each individual patient. And we support data interoperability by helping facilities improve their data accuracy in EQRS and make better use of systems and dashboards that are now available so they can have more informed information and use it more effectively. And a common thread across all the pillars that I see, it is helping kidney care community provide more patient-centered, coordinated, and effective care.
Thanks, Mary. Really appreciate you being here to represent the networks. So we've now heard from CMS, CARES, and the networks about how everyone is supporting kidney care transformation. So it's really great for us to now bring in Dawn with the patient perspective, because this work is really ultimately about improving the experience, outcomes, and quality of life for people living with kidney failure. So Dawn, from your perspective, what does patient-centered kidney care mean in real life, beyond the words that we see in policy or quality improvement?
Thanks for that question, Laura. Patient-centered care means being treated as a whole person, not just a diagnosis or a dialysis schedule. It means providers are listening to what matters to the patient, including family, work, independence, transportation, mental health, as well as daily life. Patients want clear information. We want respect and the opportunity to ask questions without feeling rushed or dismissed. It also means that care decisions should be made with us, the patient, not just for the patient. Every patient's goals, fears, support system, and circumstances are different. In real life, patient centered care feels like being heard, respected, informed, and supported, and acknowledged as an individual.
Thanks, Don. That's really important. So one of CMS's key priorities is empowering patient and family choice. So what information, support, or conversations help patients feel prepared to make decisions about treatment options, things like home dialysis, in-center dialysis, self-care, or transplant?
Great question. Patients need information that is clear. It needs to be honest and easy to understand. It really helps when treatment options are explained early and more than just once, because patients just might not be ready to absorb everything during that first conversation. Patients benefit from hearing about the pros, cons, the lifestyle impacts, and the support needs for each option. Peer support from other patients can be especially powerful because it helps people understand what each option looks like in daily life. Families and caregivers should be included when the patient wants them involved. Patients feel more prepared when they understand that they have choices and their personal goals matter in deciding what option is right for them.
So true. And for patients, families, and caregivers listening today, can you help to share maybe one practical way they can use their voice to improve kidney care for themselves or for others?
Sure. You can really start by asking questions and sharing what matters most to you with your care, with your care team. You should participate in care planning conversations. Talk about your goals, talk about your concerns and your preferences. Patients and families can also connect with their ESRD network to learn about patient engagement opportunities. That's how I got started. That may include joining an advisory group, reviewing patient materials, attending a learning session, or sharing feedback through surveys or listening sessions. When appropriate, patients can support one another by sharing experiences and practical tips. Every patient voice matters. Every one comment or story can help improve care for others.
I couldn't agree more. Thanks so much, Dawn. I think others are agreeing in the chat with you as well. So appreciate you being here with us today. And I also just wanted to thank again all of our panelists for highlighting all of the various components of the transformation. So CMS is really helping to set the vision. KHARES is providing that national infrastructure. Networks are supporting local action. And then patients are bringing that lived experience that helps keep the work grounded. So together, all of the efforts are really moving ESRD care toward a more patient-centered, coordinated, accountable, and data-driven system that truly improves outcomes and quality of life for people with kidney failure. So we do have some time left. So we're looking for some questions. We'll attempt to answer as many questions as possible, but we'll focus on those that are highly relevant to the broader ESRD community. So if there's questions coming in that are specific to a state or your own situation, we may follow up on those after. So if you'd like to put any questions in the chat, we invite you to do so. And then as we're waiting for some of those questions to come in and we're getting our queue together, I'd also like to turn over to Stephanie from the KHARES team. And Stephanie's going to share a little bit with us again as those questions come in. So feel free to put those in the chat. Stephanie, can you help share how our community can get engaged and become part of this important work?
Yes, of course, Laura. Thank you so much. I think, first of all, there's several opportunities, but I think one of the most important ones is to start with your local ESRD network. I've got the map up there of the United States and their territories. So for some of you may not know exactly what or which network you are a part of. This is broken down by state, so you can easily see, look for where state you reside in, and then look for the accompanying network on the side. The next slide is going to, and I apologize, it's probably a little small, but once you find your network, you can see who that organization is. You can look for contact information here via email or a phone number. So again, really important to start with your ESRD network, get involved there. There's a lot of opportunities, I'm sure. Mary touched on some, but a lot of opportunities for patients and providers. Some other ways that patients can get involved. I'm sure Dawn is probably very familiar with most of these and probably are already involved, but there's a lot of good organizations out there that look for patients. There's the National Forum Kidney Patient, the Advisory Council, the NKF, they have a peer support, AAKP, AKF, I could go on, the Renal Network, all dialysis patients, citizens, these are very good organizations that have not just support groups, but you can get involved, and they have a lot of interaction. They have conferences, they have podcasts they do. So there's a lot of good information out there for patients. As far as providers, again, there is numerous different organizations out there that as providers can get involved with too. The National Forum of ESRD Networks, the NKF again, American Society of Nephrology, ANA, some of these you may have heard of, maybe some of these are new to you, the American Society of Nephrology. NKF also goes into very specific, if you're Council for the Nephrology Social Workers, there's a membership and a part there, as well as dietitians have their own kind of individual council. And for NAT, for our nephrology technicians, we have NAT, a very good organization also for them. Renal Care Health and Renal Physicians Association. So really a lot of organizations already out there that you can go and seek and see which one kind of fits for you. So on the national level, I think we talked a little bit about that briefly. Vicki touched on it. We sponsor quite a few national calls like the town halls. Those are quarterly. Our first one is today, and our next one will be October the 1st at 1 p.m. Eastern Standard Time. We also hold community of practice calls monthly. Those are on the fourth Thursday at 3 p.m. barring any holidays, which are going to fall this year. So we'll be adjusting those just a tad bit. But our next one is, I want to shout out to on August 27th. We're going to have, it's going to be about what is vocational rehab. I think it's a great topic. We talked about whole health, and that's certainly part of it, getting patients back to work or back to school. We're going to have not only a guest speaker, but we're going to have a guest patient who has successfully went through the VR program and is now working. So some real life experience will be shared there. And I do want to give a shout out to our social media. That's another way to stay connected. See what's out. All of our upcoming events are posted there. So we're on Facebook, Instagram, X, and LinkedIn. So you'll find, again, ways to get involved. I'm sure the local networks also have social media. So again, finding those out and getting engaged is another way. And going back to what was, I think Ann talked about the communication toolkit. There's the link to that. There's a lot of good information that CMS has out there about that communication toolkit you can find. And I do believe now we're going to turn it back to Laura and see if we've got some questions. So if anybody has any, please feel free to drop them into the chat now.
Yeah.
Thanks so much, Stephanie. Really helpful suggestions. So we'll now probably take about 15 minutes or more if we have other questions being submitted. I'm seeing quite a few coming in through the chat, and you're welcome to continue submitting as we go. And Vicki from the CARES team is going to be helping to direct those to each of the panelists. And again, we'll probably prioritize those that are most relevant to the broader community. Vicki, is there a question you'd like to start with?
Yeah, we'll just kind of go down the order. I think this one's for you, Stephanie, about how people can stay informed about upcoming CARES activities and resources, for the future.
Yeah, so I send out, we send out quite a bit of communication via just email from our listserv. But again, if you follow us on any of our social media accounts, we are, we're posting them there. We're working on our website, so that's going to be another place that I'll be able to direct folks to. They can go see. We'll have current upcoming events that will host the recordings and slide decks from the previous events. If you aren't able to get on a call, you can still have that opportunity to see it. So I think, we're working out that several different ways that people can stay connected.
Awesome. And then I'll take the next question just while I'm on the mic from Adeline. How can CARES help with CVC removals due to vascular surgeon limitation? I do think this is an important issue for you to approach with your network if you saw that network map, because they can really get into the data. Obviously, working with physicians and vascular surgery requires really looking at how other communities have been able to perform successfully and what their rates and numbers are, and kind of sharing that data. And I think your local ESRD network would be able to provide you that information to take to your maybe to your nephrologist to broach those discussions with your vascular surgeon. One thing that CARES could do, and we have done this in the past, and maybe we'll go back and add this to a list of things to consider, is we do develop change packets, and those focus on how to overcome a barrier. And I don't think there's been a lot lately updated about CVC removal and vascular access. So we could go back and hopefully promote another change packet that might help you gather some tools and resources to use. So those would be two ways. I definitely start with your network, and then we'll try to overlay some national tools. There's a lot out there, but maybe just brush some of those off or help you get some new ones to remove your CVCs. So there is a discussion about you're discussing improvement on data interoperability. Is the Renal Services Exchange, a subsidiary of the Renal Healthcare Association, the only application platform able to integrate patient data to EQRS? I know all the LDOs have their own system. I don't know if anyone else has a other suggestion besides Renal Healthcare. I know they serve the independents and the small dialysis organizations to integrate an EQRS. You can also go to separate EMR systems or providers, and they usually have their own integration platform to go into EQRS. And if any of the other panelists have a suggestion of different sources that they could use to help, I do think it's very important to use a system that will integrate you into EQRS. It is vitally important for your QUIP scores and your overall functioning. So I love the question and trying to provide as much ideas about resources. Anyone else have a suggestion?
I
Okay,
don't
not
necessarily have a suggestion,
Go
but
ahead.
I
Sorry.
strongly encourage exactly what Vicki stated is to make that linkage with EQRS.
Yeah. And maybe there's a question about, were the networks recently restructured? If so, what prompted this change? Maybe there's some clarity around that you could help the ESRD community understand.
Without going into a 30-minute discussion, I'll try. So the ESRD network program is aligned with the statute, and we do a 5-year procurement. And so what happens is every 5 years, we take an opportunity to step back, we look at our lessons learned, and then we put out information for qualifying participants to engage in being a part of this network program. And so we did that just recently, and it went into effect May 1st, 2026. So it did shake up some things. Some folks adjusted, but we have a really solid organizational structure across these 18 networks. Many of the people you've heard from today. Yeah, that's without going into 30 minutes of discussion.
And I know that there are definitely patient groups that are focused on pediatrics. We can send some resource links about that. I don't know, Dawn, if you have any known pediatric groups that you could reference for this question.
Sure, Vicky, right off of the top of my head, I think of Lori Hartwell and the Renal Support Network. She may have some activities or some resources that may be helpful for the pediatric community. But I would defer to you, Vicky.
I agree with that too. And I think NKF has a pretty broad spectrum of pediatric resources
Sure.
and groups. They also have a peer-to-peer program. And do they do pediatrics in their peer-to-peer? I don't know, Don.
I'm not sure either.
Yeah, I would definitely dig into the NKF and Renal Support Network, but we can look around at other resources. A lot of your pediatric providers, so hospital systems that support pediatric programs, they will also have their own independent patient groups because they know how important it is to keep these young people who are going through this traumatic illness together. So I think even your hospital system might be able to provide you some support, or your pediatric provider as well. So, but we will definitely, I'm going to take that as a note and make sure we see if there's any other resources we haven't mentioned. Then another one is, our clinics are engaged in quality improvement projects using the PDSA framework. Can the network with us to work with us to help develop action plans? So I'm going to turn that one to Mary. Mary, you could maybe give some ideas about generally how the network would work.
Sure, absolutely. If you've been enrolled to work with the network or not, and you just want to reach out to your network because you have something that you want to improve in your facility, each one of the networks can definitely work with you to help develop an action plan. We've got templates, different resources, toolkits that you can use. So absolutely reach out to the network that you're in to find out what they can help you and assist you with developing your action plans.
Thank you, Mary. That's great. This one might come to you too, Mary. And I don't know, it could be more of a broad question. This is from Neeland Lewis. He said, thanks for today's insightful forum. What are some of the lessons learned after being awarded the new SOW or statement of work? Are there any planned face-to-face sessions for 2026? One thing I can say, Neeland, is there is the annual quality conference, and we do try to bring patients together for that. But Mary, maybe you could kind of share your expertise or knowledge about lessons learned with after the award of your new statement of work.
Hmm. Lessons learned on the new statement of work. I think it's really focusing our work on, incorporating the patient voice and looking at it as the whole health. That was something that was new. Looking at nutrition, that was something new. We've always focused on things like that to an extent, but it's more targeted with that, and bringing back the depression into our work. That's something that I think is important because we need to focus on the whole health and the mental status of our patients. Things are becoming a lot more challenging out there. So other than I think the home, I think that they did a great job of changing that up to, instead of focusing at the incident versus the transition and having it all as just growing home. Um, Other than that, I think that's pretty much it, unless Vicky or others have any insights that they've thought of for that. The interoperability, that's really new to us, and we're really going to have to dig into that and figure that out a lot more, um, to see what improvements that we can make in that avenue.
Yeah, I think one of the things, Mary, when I think about the work from the network side and even moving forward, is trying to get much more information. You talked about conveners bringing all the right people to the table, so really trying to work more with transplant centers and CKD educators and some of the different people that we don't always loop into the discussion to help with these modality discussions and things of that nature. So that's kind of a going forward lesson learned thing that we really want to throw the net wide, and talk to a lot of people to try to get all that information to patients sooner. Do you think you could also answer this one, Mary? And this one could go also to Anne, if there's anything at CMS's level. Have the networks considered reaching out to the various EMR vendors to help standardize some of the quality reporting and QAPI workflows? So I guess they're looking for like a structure that would come from the networks or CMS to really, standardize the workflows. And I don't know if anyone has, I know we have Jim on as well, I believe, that might know something if there's anything in the work about that, but I haven't heard of that. Mary, has anything happened at network levels that you're aware of?
Not outreach to EMR vendors because, the large dialysis organizations are already on their platforms. And as far as independents, there could be a wide range of EMRs that independents are using. And that would take, the environmental scan, which I believe that CARES may be doing alongside CMS in the future. But, we don't have information for each provider on what EMR they're currently using.
Yeah,
Exactly. You nailed it. That would be a very big scope to kind of tackle. But we are definitely hearing that question, and we'll take it back and we'll, think about that. But that would be a humongous task to kind of to undergo.
Thanks, Dan. Thanks. There was one individual who asked about recommendations on increasing transplant referrals. They have a clinic that has a large majority of over 70-year-old patients. Again, I would really defer you to your network. They have great resources to help you. This is that individual local issue that they need to overcome. There are very many transplant programs that are can easily transplant people over 70. We have experience working with transplant programs that have great protocols and work with individuals. It's all based on quality of life, but that the age shouldn't be a barrier. And trying to work with your transplant center to open those pathways, I think, is definitely work that networks can help you get the support and the information to move that forward. So, Mary, if you want to jump in there and provide any other insight.
No, I think that's really important. Reach out to your network. They also may have the criteria for each one of the transplant centers that you can review, and some may not have that as a criteria.
Yeah, and then you can selectively send to somebody who might do older patients more frequently, if you were able to find a center that was successful. That we have a person who just wrote that they have a transplant up to 86 years old. So you can
right.
keep transplanting a long time. And there's also a comment that there is a QAPI template that's under work in the RHA. So that's interesting to know and see how that would standardize and work in the workflow. Um, I I don't have, and there are people putting in that they don't have age limits. So I'm hearing a lot about people willing to transplant longer. So we probably just have a transplant center that we need to work with in that area, and definitely reach out to your network. Laura, I think I've gotten through all the chat questions. I don't know if other questions were provided to you or you have some other questions that were on queue.
I'm not seeing any other in the chat, but I do want to invite any of our other leads that are on the panelist line, whether you had a speaking role today or not. If there's anything else that you'd like to add about the program, the vision, strategy, how this really makes a difference from a patient perspective, I would welcome any of our panelists to jump in as well.
I'll just jump in, Laura, and give a little encouragement to any of our patients that might be listening today. You know, getting involved is a big part of our healing process. And, you know, volunteering your time to peer mentor or visit patients in dialysis centers, that can be really, really helpful. Um, Not only for the patients that you're going to visit or that you're mentoring, it's really helpful to yourself. And so I just want to encourage anybody that's interested in getting out, advocating, and volunteering. There is so much work to do out in the kidney community. And, you know, we work until we're tired, but we are always looking for new people to bring on and teach so that you can learn how to stand up for yourself and speak out and help other patients to become empowered as well. So if you're, you know, interested in volunteering or you're interested in getting out and starting an advocacy, I would direct you to your local ESRD network. They are the perfect place to get started. They helped me grow up many, many years ago when I first started dialysis, and I can't be more thankful for what I got from volunteering and being a part of my ESRD network. So that's over 30 years ago, and thank goodness, you know, we're still doing great work. So don't just sit around and, you know, want to say something and want to speak up. Stand up and be heard and be involved.
I love that, Dawn. There's such power in that. I imagine in your 30 years of being involved, you've seen a lot of really impactful changes. Are there any examples or stories you might want to share with us about maybe how you personally helped to shape some sort of a quality improvement activity or initiative in partnership with one of your networks?
Wow, you know, I've been a part of my ESRD network, like I said, for decades. So I've seen so many great, exciting things. I remember back in let's see, it was around 2010 when the conditions for coverage came out, and no patients didn't understand what that all meant. And we spent a lot of time as patient advocates going over the conditions for coverage and reciting them different things back to the patient community. We would have the patient education meetings, and that was just always something that made me really, really proud that we were able as advocates to learn information and then take it back to our communities so that patients could understand and they could make better decisions for themselves. Another example of that was the oh, I just got a whole, oh my goodness, I just forgot my whole train of thought. Another example of that was when we did at Network 2, we did kidney school for a whole team of patients, and they all we had about 30 people that all did kidney school together, and they all ended up being patient advocates afterwards. So, we get a whole bunch of us together and we brainstorm and we come up with some wonderful things that are helpful, not only for, like I said, not only for ourselves, but for patients at large.
I love that. There's a lot of power there.
Yes.
We had one other question come in. This is the second time I have heard of quality of life goals. The first was CMS considering this as a QUIP metric. Any take on that? So I don't know, Anne, if you'd want to speak to that at all, or.
So as I mentioned early on, and I was walking through, the connectors on the 4 pillars, we kind of talked about transparency. And so one of the things that our leadership charged us with at the very beginning of writing this new statement of work is really taking the moment to step back and think about measuring what matters. And the alignment across all CMS programs. And so we did a deep dive and we looked for as much alignment with the quality incentive program, as I mentioned, QUIP. And so we, in our original statement of work, we did have some quality goals, and we still have those in the statement of work in regards to like monitoring activities. And again, having the space where the patient voice, the patient life journey is leading this conversation, there is a lot of alignment and a lot of thought and a lot of intention around making sure that we are connecting that and elevating that as much as we could.
Awesome. Thank you.
Thanks, Anne. Not
I
seeing
think that's-
any other questions in the chat. We'll do one last call if anybody has anything else you'd like to put in.
Of course, we'd love to hear from you. This is our first town hall of the new contract period. So please take a moment to complete the event assessment when you get a chance. And we got a big long question, Laura.
Okay.
In considering the focus of care coordination, one of the challenges for dialysis providers that is confirmed by the CY 2025 achievement goal of 18.1% is the rate of CVC access for a referred new ASRD patient. The rate is increasing and the patient base is not only those new patients coming from ED setting, but also nephrology practices. The other challenge is the response time from vascular practices to initial consults and scheduled surgeries and post-surgery placement approvals. Some areas have identified the issue as scarcity of resource. Has CMS considered imposing a reimbursement penalty for, I would imagine, high catheter placement? I don't know if I can't see it or if it rolled off the I don't think this is a form that we discussed the actual payment structure, but I know that we watch for CVC placement and we look to work to drive quality improvement to reduce that. I don't know if Anne, if there's any other comments you'd want to make.
The ESRD network program doesn't penalize. So we'll start there, right? We are in a supportive role. We are trying to charge towards quality improvement and supporting interventions that will get everyone to that targeted goal. We do not penalize. That is not our scope of work.
Thank you, Anne. Said that more clearly than I.
Thank you. Appreciate that. So it looks like we're coming to the end of our time. I just want to, again, thank all of our panelists and for all of our attendees for joining and engaging with us, especially during this Q&A portion. We really appreciate your partnership as we work together to advance kidney care transformation. And as Vicki mentioned, we do have an assessment that you will receive. We'd love for you to take a minute to fill that out. That really helps us tailor our programming in the future to meet and exceed your needs. So please take a moment to do that. Thank you again, everyone, for attending, and I hope you enjoy the rest of your day.
Thank you.